avian vein. It's a very short segment though. I'd have to have the pointer right there. Okay? Which is a little different than this heart here, because this heart here shows, you know, from here to here is brachiocephalic vein. Boy, on this one, boy, it's like tiny, tiny bit. Then immediately it becomes superior vena cava. Okay? On the left side, I have left brachiocephalic vein, I have left jugular, I have left subclavian, the rest has been cut off on the left side here. Okay? On the torso, okay, taking a look at the pulmonary area, when I have blue vessels in the lungs, they are arteries or veins. Okay, so these blue things are pulmonary arteries. They're delivering deoxygenated blood to the lungs, and oxygenated blood is going to go back. So the red things are pulmonary veins, and the pulmonary veins are going to come all the way over and enter into the left atria. Okay? The pulmonary trunk is what's delivering to the pulmonary arteries. So I have the pulmonic semilunar valve, pulmonary trunk, pulmonary arteries delivering blue blood to the lungs. Blood coming back from the lungs is red. Pulmonary veins goes to the left atria, goes through the left atrioventricular valve, mitral valve, bicuspid valve, goes to the left ventricle, goes and gets delivered up throughout the aorta. Okay, we did the upper part and the arm. We're coming down. The first branches that don't show very well on this are the coronary arteries, but then we come down. We have thoracic branches coming off on this, which show on this a little bit. Those are thoracic branches coming off the descending aorta. So with each rib we have a thoracic artery. Okay? Now, coming below the diaphragm, the first major piece that comes off of this is the celiac trunk. Here we show it as like almost a spider web. We have all of these things coming off. So when we follow this down, we get this little network of vessels right here. Now, if I kept slicing frontal sections down, eventually I would hit the aorta with one hose coming out. So even though it shows it has all these vessels coming out, if I kept doing frontal sections deeper and deeper, I would hit one hose coming off. So this shows the celiac trunk excellently. Okay? The first thing below the diaphragm is a hose coming off, and that is the celiac trunk. Okay? If I came out a little further, I would see the gastric, splenic, hepatic arteries branching off of that. So we have the celiac trunk, which is a very short but very stout hose of blood, and it immediately splits into all of these. So that model shows the celiac trunk very, very well. It comes up a little bit and then immediately splits into all of this stuff. Now here I have a left gastric, I have a splenic, and I have a hepatic. Okay? Now I come down the aorta a little further and I see another hose coming off. That is the superior mesenteric artery. Its partner is this inferior mesenteric artery. So this superior mesenteric artery has been cut very short, but there it is. Okay? We come down a little further, we see the inferior mesenteric artery. Paired here we have renal arteries, we have gonadal arteries. We're still in the descending or abdominal aorta. We come down and we split to common iliacs. Something goes internal, that's internal iliac, external iliac. Okay? Once we pass this point, we become femoral. So this shows the femoral vein to here, popliteal, posterior tibial, anterior tibial. And all the way down somewhere else. I have a dorsal pedis artery and a medial plantar artery.
Which is which?
Plantar, medial plantar, dorsal pedis artery. Dorsum of the foot, plantar surface of the foot. Following back on all of the veins on this, I have a dorsal venous arch, I have a small saphenous, I have a great saphenous. I have a lateral and medial plantar vein, a lateral and medial plantar vein. I have small saphenous, great saphenous. I come up, I need you to recognize the femoral vein's been cut here. So it's different than the saphenous here. So this cut here, there was a femoral vein going here. Okay? We come up, we see the external iliac binds with the internal iliac vein, goes to common iliac vein. We finally branch up to the inferior vena cava. Coming up, we see branches for the renal veins coming from the kidneys. And then we start getting messy with the portal system. Okay? All of the blood that went to the spleen, the stomach, and the intestines is going to head to the liver before it jumps back into the venous blood. And that's the portal blood system. So here we see a splenic vein in purple. We see an inferior mesenteric vein in purple. We see a superior mesenteric vein in purple. We see a gastric vein in purple. These are all coming and heading to the hepatic portal vein and going to the liver. This one has a gastric right here. This model over here is not color-coded.
Which one's
This is not color-coded, but it does show everything. Okay? If we follow down on this model, we see a celiac trunk. Okay? We see a superior mesenteric artery. Paired along with it is the superior mesenteric vein, even though it's not in purple on this model. But here is the superior mesenteric artery. Right alongside of it is the superior mesenteric vein. Coming down, I see the inferior mesenteric artery. Going alongside of it is the inferior mesenteric vein. Okay? Inferior mesenteric artery. Right next to it is the inferior mesenteric vein. They're not purple on this model, but they would be purple on most models. Over here I have the superior mesenteric artery, and right next to it I have the superior mesenteric vein. Those two are coming up, and they're eventually going to join the hepatic portal vein. But first we're also going to have the splenic vein, the gastric vein, all delivering their nutrient-rich blood to the hepatic portal vein going to the liver. The other thing going to the liver is the hepatic artery. Okay? So going to that hepatic system again, I have a superior mesenteric vein. Superior mesenteric artery. Right next to it I have a superior mesenteric vein. In normal models it would be purple, okay? So in this model we know what it is, it's just not purple. I have an inferior mesenteric artery, and right next to it I have an inferior mesenteric vein. They come together and they're going to form the hepatic portal vein. It's purple. But they're going to join the splenic and gastric veins, and all of this blood is going to go to the liver before it gets dumped into the body. So the hepatic portal vein is delivering blood to the liver. The hepatic artery is delivering blood to the liver. And then the hepatic veins are going to dump into the inferior vena cava. So on this model, we have, on this side, we have the superior mesenteric vein. We have an inferior mesenteric vein.
I thought you just said the opposite just 3 minutes ago.
Okay.
On this model, I mean.
Right. On this, okay, then I'm reversed, okay? Because on the right side, this is the superior mesenteric vein. This one that's been cut off is the inferior mesenteric vein. So this one you can kind of see how they're paired together. Inferior mesenteric artery, inferior mesenteric vein coming up. Superior mesenteric artery, superior mesenteric vein coming together. They come together and they're forming this purple blood. But you can see they're picking up the splenic vein, they're picking up the gastric vein, and they're making up the hepatic portal vein, and it's kind of drawn in purple on this model. The hepatic veins are drawn in blue, and they're going into the inferior vena cava.
Which, on this model, which one is the inferior and which one is superior?
This is the superior.
That one is.
And this one over here that's been cut is the inferior.
Okay.
That's what I thought. I thought you said it reversed.
I probably have said it
originally.
reversed. This one, you can follow them up because there's the inferior mesenteric artery. You can see the inferior mesenteric vein going right. Even though it crosses real close to the superior mesenteric artery, it's coming from the lower part.
Okay.
Here you have the superior mesenteric artery. Right next to it, you have the superior mesenteric vein coming up on the right side.
All right.
Okay? I said I was going to skip the brain model, I believe. Yes. Okay, we had a liver, pancreas, spleen model. Okay? Again, this sits in the body like this. This would connect right to that celiac trunk like that. This celiac trunk, that hose coming off is this hose that's been cut right there. So this, if this could fit, it would fit just like that. So when the celiac trunk comes off, it goes into a splenic artery, a left gastric artery, a hepatic artery, okay, and a duodenal artery. So that celiac trunk is going to feed all of those areas. Now here I see the splenic vein coming back, okay. This also shows you a little bit, this is the superior mesenteric artery, okay. It's coming off the abdomen, and right next to it is the superior mesenteric vein. This is the inferior mesenteric vein. So I have the splenic vein, inferior mesenteric vein, and I have the superior mesenteric vein all coming together to form the hepatic portal vein in purple. So the two things going to the liver here is going to be the hepatic artery and the hepatic portal vein. They're both going to the liver. Okay? So looking at this side, this is the superior mesenteric artery with the superior mesenteric vein next to it. This is, we don't see the inferior mesenteric artery because it's coming off down here, but we do see the inferior mesenteric vein coming up. Okay? On the liver, okay, this liver goes in the body like this. What we're looking at here, all of the blood that's coming from the hepatic portal system, splenic vein, gastric vein, superior and inferior mesenteric veins are coming all together, and that's the hepatic portal vein. It's delivering blood to the liver to be processed by the liver. Okay? Right next to it is the hepatic artery, which is a branch off the celiac trunk. So the two things feeding blood to the liver are the hepatic portal vein and the hepatic artery. Once the liver has done everything with those two blood supplies, blood is drained into the hepatic veins and goes into the inferior vena cava. Okay? When we do the digestive system, we'll talk a little bit about the green, the gallbladder, the bile, and stuff like that. Right now, what I want you to realize in terms of the blood flow, two things are going to the liver, a hepatic artery and a hepatic portal vein. They're both going to the liver. Draining the liver are the hepatic veins going into the inferior vena cava. Okay, on the lymphatic system, basically, knowing some regions of the body is what's going to help you on this. Okay, we have axillary lymph nodes, cervical lymph nodes, thoracic lymph nodes, inguinal lymph nodes, just regions of the different lymph nodes. You have thoracic ducts, which are draining into the venous blood supply. There's one that comes up here and goes in here, one that goes in here. You have the cisterna chyli, which is, if you follow this thoracic duct, there's an expansion right behind everything. Right behind everything, where my finger is, there is a cistern, or an expansion of this duct. That's a cisterna chyli. Okay? You have cervical, axillary, bronchial, intestinal, and groin lymph nodes, and that's all. Thoracic ducts, just make sure you've looked at everything on the thoracic ducts. They show on this heart, they show on this model, they show on that large torso. On this model here, this shows the portal system very clearly. It's just not in purple. Okay? So make sure you can cross that line and realize that they've drawn the hepatic portal system here in blue, just like it was venous blood. This is the hepatic vein draining the liver into the inferior vena cava. All of this blood, this is the hepatic portal vein. All of this blood is coming into this as purple, and it's delivering blood to the liver.
Where do the mesenteric arteries go?
They go and feed the intestines, large intestines, small intestines. So all the nutrient-rich blood, that's what's making them nutrient-rich. All of the inferior and mesenteric arteries are going to the intestines, picking up nutrients, and coming back inferior mesenteric veins. So that's why we kind of draw it purple. We deliver a lot of blood, we don't deoxygenate it completely.